You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Peter Ferraro. Dr. Peter Ferraro is the founder of Ferraro Spine and Rehabilitation, a multi-specialty wellness facility serving northern New Jersey and the New York metro area for the past 18 years. He is voted as a New Jersey top doc for 2015. His advanced non-surgical approach to the treatment of many spinal conditions has awarded him numerous awards and accolades, but none better than a high success rate through his self-designed treatment protocol, the Ferraro Spine Method. Dr. Ferraro also is the Chief Clinical Officer of Optimal Wellness and Optimal Executive. These companies have given Dr. Ferraro the chance to be the Chief Wellness Officer of the NFL Alumni and Professional Basketball Association Alumni Wellness Challenges. Both of these events brought together sports alumni in a competition to achieve a greater level of wellness in their lives, post-pro sports careers. Dr. Ferraro is widely considered to be one of the top chiropractors in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, the Ferraro Spine Program and herniated and degenerative discs. How are you today, Dr. Ferraro?
I'm doing great, thank you.
Oh, thanks for being here. We are ready to dive in, and the first question I have for you. Today, we'll be discussing some specifics on herniated and degenerative discs. Let's start with the basics. Can you explain what a herniated or degenerative disc is?
Herniated degenerative disc is a condition that millions of Americans, people around the world, suffer from. The disc is a structure in between all of the vertebrae in the spine, from the neck all the way down to the lower back. And each disc is there, and it really serves two main purposes. It's a shock absorber as well as a spacer. And it really, in a very rudimentary fashion, think of a jelly donut. You have these outer fibers made of cartilage that actually hold this jelly material that's made of this sugary substance in place. And that shock absorber is there so that each bone segment doesn't jam into the other. And the spacer part of it is that it also allows room for the exiting nerve roots that come off of the spinal cord to be housed. And so when someone has a herniated or degenerative disc, the potential problem is that they're getting some type of nerve compression, which then further leads to severe pain. It could also lead to their muscles not working correctly, their reflexes not responding as well as they should, and in a whole series of potential negative effects that would occur from that point on.
Okay, and how does someone find out they have a herniated or degenerative disc versus, just somebody that says, oh, my back hurts? How do they really find out that they specifically have that issue?
The only true way to find out if someone has a herniated or degenerative disc is by an MRI or a CT scan. Any other imaging like X-ray or ultrasound, X-ray will really only show you the bone and the separation between those bones, but it won't show you the soft tissue. So the best approach is obviously an MRI. Now, when a patient is in office, there are a series of orthopedic and neurological tests that we can do to get a pretty close understanding of whether or not someone is dealing with a disc, but the only definitive way to completely rule it in or rule it out would be advanced imaging like an MRI or a CAT scan.
Right, but they could go see the chiropractor first to sort of say, okay, yeah, we're headed in this direction. We're going to send you for an MRI. Okay, good. And then could you describe a typical chiropractic treatment program for someone suffering from a herniated disc?
Typical chiropractic treatment program for someone suffering from a herniated disc, number one, first and foremost, is to try to reduce their inflammation. So it's a more gentle technique. It sometimes relies upon some different equipment that we could utilize, whether it be some light vibration or some flexion distraction, some manual release massage, things that can help to just reduce some of the inflammation, as well as some light chiropractic manipulation techniques. What we like to do at Ferraro Spine and Rehabilitation is combine not only the chiropractic adjustment and chiropractic treatment, but utilize our other integrated specialists like our physical therapy department, our acupuncturist, as well as our spinal decompression to act as a team approach to help someone dealing or suffering from a herniated disc.
Right. Okay. And that's great. That leads into my next question, which was going to be, are there additional sort of alternative therapies or treatments like acupuncture? And maybe you could talk a little bit about how acupuncture works, because I know people seek acupuncture treatments for a variety of conditions. How does it work, with say the herniated disc problem?
Acupuncture for the herniated disc problem has been such an amazing asset to our practice. Prior to bringing acupuncture in about 5 years ago, we were doing the spinal decompression, the Ferraro Spine program, with spinal decompression, chiropractic care, and physical therapy, and we were having great success. Once we added acupuncture, we immediately saw a reduction in our patient's symptoms almost immediately. The acupuncture, especially having a specialized acupuncturist who deals with herniated discs, is able to locate where the muscle inflammation is happening because of the inflamed nerve from the disc herniation, and really allow that to reset and not be so painful. So the addition of acupuncture, as well as acupuncture and massage combined, is a great, great addition to what it is that we do at Ferraro Spine and Rehabilitation.
Great. And you have separate staff. Clearly, you have an acupuncturist, you have massage therapists. It sounds like you have a huge staff there that works as a team. Is that true?
We do have a great staff of integrated professionals, from chiropractic physicians, doctors of physical therapy, exercise physiologists, acupuncturists, massage therapists, nutritionists, all working hand in hand to help these patients that are suffering from these debilitating conditions, as well as having a team of medical physicians, orthopedic surgeons, neurosurgeons, pain management doctors that we also work hand in hand with for those patients who need a more aggressive approach. And what we like about our team is that we all work together. We even do a grand rounds presentation weekly so that we can all keep up to speed on exactly what's going on with our patient base.
Oh, that's fantastic. All right, so back to the patient himself. What happens if they ignore the problem for too long and it technically is a herniated disc, and they ignore the problem for too long and hold off on getting treatment? What happens typically to that person?
Patients that typically ignore the problem for a prolonged period of time, unfortunately, when that happens, some of the effects of those herniated discs or bulging discs can become more permanent in nature. So if someone is dealing with a disc that has happened fairly recently, whether from a trauma, some type of slip and fall, or a motor vehicle accident, a sports injury, those problems can be addressed, and rarely are there permanent damage, unless obviously there has been some effect to the nerve. If in fact someone has left a injury like this for a period of time, the effects can be long term. And even though we can reverse some of those effects, certainly seeking treatment and seeking to know exactly what's going on sooner than later is always recommended.
Right. Well, thank you so much.
Thank you again for having me. I really do appreciate it.
Thank you. And your, the team approach is truly fantastic. It's a great resource, I think, for people out there that are suffering with some back issues. And for everyone listening, thank you so much. And if you're speaking with Dr. Peter Ferraro, if you're interested in making an appointment or speaking with him, you can either go online to www.ferrarospine.com or call 973-478-2212 to schedule an appointment. On behalf of our entire team at RazorCast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.